It's difficult to overpraise iodine. It's an element that our bodies simply can't do without, and it has to come to our diet in appropriate quantities so that development is not affected. Iodine is a chemical element which is the heaviest and the least available of the stable halogens in the human body. Iodine exists in thyroid hormones and thus it's essential for thyroid function. Iodine deficiency affects about 2 million people and it's the leading preventable cause of intellectual disability. The synthesis of thyroid hormones is completely dependent upon iodine. They're called T3 and T4, containing 3 iodine atoms and 4 iodine atoms. This makes iodine a central component of the thyroid health. In developing countries, iodine deficiency is the leading cause of low thyroid hormones or hypothyroidism, and this can be prevented by correcting the iodine status. On the other hand, excess iodine can be detrimental to the thyroid health, so it's essential to keep its dietary intake within the recommended range. The lack of iodine in the diet of pregnant mothers and small children can have detrimental consequences on their physical and their cognitive development. In young children, iodine deficiency results in low stature and a form of intellectual disability called cretinism. In the 19th century, the condition of such children was improved by the addition of thyroid extracts in their diet, but it never improved the development of their intellect, only the body. The other consequence of iodine deficiency is the enlargement of the thyroid gland, or goiter. At present, the main method of preventing cretinism and goiter development in children is the introduction of iodized salt in the everyday diet. Several studies have shown that the introduction of iodized supplements, mostly iodized salt, in the poor areas of Asia and Africa, consistently improves the physical and mental condition of children. For instance, a study focused on the effects of iodized salt and other types of iodine supplements in villages of benign Africa, and it showed that the children were doing much better with school tasks and tests compared to the children with low iodine levels. A similar study was carried out in eastern China, and it showed that the introduction of iodized salt in the region led to a decrease in goiter incidence among local children. The same effects were observed after the introduction of iodized poppy seed in villages in children of Western Côte d'Ivoire. Severe selenium deficiency makes children significantly less responsive to iodine supplements, so it's important to account for selenium intake also. The importance of iron supplementation in children with goiter was corroborated by an independent study in Iran also. In pregnancy, the mother requires a lot of iodine, especially in the early stages, as there's an increased hormone production. Iodine has to be transferred to the developing baby, and there's a significant loss in the urine. Severe iodine deficiency in the mother affects the child's brain development greatly, and it can lead to cretinism. Mild iodine deficiency causes abnormalities in movement and intellectual development of the future child. Pregnant women require about 250 micrograms of iodine per day, and several studies have shown that supplementation during early pregnancy is essential in iodine deficient hypothyroid mothers. For instance, it leads to an increase in the body weight of the newborns, lower newborn mortality, and improved development in young children. Recently, a study has shown that there is a high risk of iodine deficiency in women with high levels of obesity. Also, in the case of pregnant women, excess weight can be an additional risk factor of developing deficiency in early pregnancy, which affects both the mother and the child. In 163 women with both excess weight and iodine deficiency, the intake of 200 micrograms of iodine lowered cholesterol concentrations in their blood. In children with a mild form of iodine deficiency, iodine supplementation lowered both the markers of inflammation and cholesterol, which helps to prevent heart disease. At present, the recommended intake of iodine in the US and Canada is 220 micrograms in pregnant and lactating women, and 150 micrograms in non-pregnant women and males. In the countries with low income and low iodized salt coverage, up to 250 micrograms daily. A recent review also postulated that women living in a population with a median urinary iodine content at or above 100 micrograms per litre are not in need of iodine supplementation during pregnancy. On the other hand, if the population's median urinary iodine content is below 100 micrograms per litre, then the pregnant women should take iodine-containing supplements. In regions of moderate to severe iodine deficiency, where no iodized salt is available, it's sufficient to give lactating women one dose of 400 milligrams of iodine in the form of iodized oil soon after delivery, so that they can give their infants sufficient iodine for at least 6 months. Giving any form of supplementation to newborns low in iodine was not considered to be effective. Surprisingly, iodine deficiency can be present even in developed countries. For example, the United Kingdom is ranked among the top 10 iodine deficient countries in the world. It's crucial not to take too much iodine also. The safe upper limit for iodine intake in adults is 1,100 micrograms per day. The Japanese, however, tend to consume up to 3,000 micrograms per day with their high seaweed diet. In a study carried out in China, the intake of iodine that exceeded 250 to 499 micrograms per litre led to iodine deficiency disorder and subsequent hypothyroidism. This is due to so-called Wolff-Chakoff effect, when an excess of iodine leads to a decrease in hormone production by the thyroid gland. The thyroid gland in the baby develops on 10 to 12 weeks of pregnancy, and in a case of excess iodine intake by the pregnant mother, hypothyroidism can develop in children also. There was a report of mothers that overdosed on iodine during pregnancy. The children of 3 mothers were diagnosed with hypothyroidism. The correction of the condition was achieved by stopping this overdose coming from the supplements. The same condition was reported in children born to Japanese mothers that ate a lot of seaweed during pregnancy. Additionally, excess iodine intake is a well-known risk factor for autoimmune thyroid disorder. Besides such factors as the content of iodine in food and water, some diets can directly cause an iodine deficiency. For example, it was noted in one recent study that the exclusion of iodized salt recommended for hypertension can cause an iodine deficiency. Among patients with hypertension on a no-salt diet, 24% of men and 40% of women had low iodine concentrations in their urine, so it's important to seek alternative products in such cases. Soy isoflavones can contribute to goiter in susceptible individuals. However, soy consumption may impair thyroid function only in the presence of an iodine deficiency or other contributing factors. Infants fed exclusively soy milk without supplemented iodine are at risk of iodine deficiency. Cruciferous vegetables such as kale, cabbage and broccoli are potentially goitrogenic or goiter-promoting foods, and these can reduce the uptake of iodine by the thyroid gland. You can see my videos on kelp and bladderwrack seaweed for more information on natural iodine sources. For more information about herbs, supplements, or natural treatment plans, check out my website.